Can I stop foam minoxidil Rogaine safely after about 20 days of use? I have thinning at the crown and the front hairline. I started Rogaine and had no idea how bad the shedding would be. I've also been experiencing the side effects and don't want to make this a long-term problem. I know you can become dependent on minoxidil and wanted to make sure I haven't hit that point yet.
Thank you for your question. You stated in your question that you've been using Rogaine foam for 20 days and that you expressed a concern that you developed some shedding, some side effect issues, and you want to know if it's safe to stop and that you're concerned about a dependency on Rogaine. Well, certainly I can assist you with this question. You described also a thinning problem in the crown and the frontal area. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island. Hair loss treatment is a very large percentage of my practice. I'm the founder of TrichoStem Hair Regeneration Centers, which may be of interest for you because this is a treatment for hair thinning that is not surgical and it does not require the use of medications. So to begin with, let's just review a little bit the medications that are options for you, assuming for male pattern or what's called androgenetic alopecia. You have two drugs. You have finasteride, which is a pill you take daily, which blocks a conversion by an enzyme called 5-alpha reductase of testosterone to dihydrotestosterone or DHT. This is a pill that you take daily, and it can help 60% of men who take it. 40% men don't respond to it. And unfortunately, it has been associated with a lot of controversy, which remains to be defined completely about long-term sexual side effects, which is why a lot of the men who come to see us will not take it. Then there's Rogaine, which has been around since the 80s, which is a drug developed from a side effect observation of a drug that was minoxidil for hypertension. Now, the symptoms you described of shedding and potentially irritation is a well-known symptom of the use of Rogaine. Now, as far as stopping it, I think it makes sense to stop something that's causing you to have hair shedding. I would suggest that you consider learning about a treatment that we've developed. It's called hair regeneration. This is a treatment for male pattern hair loss and female pattern hair loss, which involves injections that are performed in the scalp in a way that is using a combination of platelet-rich plasma and acellular matrix. Platelet-rich plasma is a concentration of the wound healing and growth factors from your own blood, and acellular matrix is a wound healing material that was originally developed for the purpose of surgical wound healing. We used it as a part of the hair transplant procedure with the desire to improve graft survivability as well as to help improve the wound healing of the donor area. A fortunate side effect was that thinning hair actually became thicker. It took time for us to develop a method and a process that would be applicable to both men and women, all ages, and the different variations of hair loss pattern. So we've developed that, and now we've developed a company called TrichoStem Hair Regeneration, with the intention is to bring this treatment closer to people who can't come to us. We have patients who come from all over the world, and being in a place like New York City, it's fairly convenient for that to happen. But I think you're at a point where you don't really have that many options. You may consider a transplant, but I think that anyone who understands transplants will understand that there is a limitation from the donor area as well as the amount of density. And the challenge is can you get enough hair to keep up with the loss? And as a general rule of thumb, the answer is no. Hair regeneration is basically successful in stopping hair progression in terms of hair loss, so which means you stop thinning. You will reactivate hair that has not been growing, and you will take thinning hair and make it thicker. So that combination of factors from a single treatment, and in some cases we'll do another treatment 12 to 18 months later, is really unparalleled and is part of, I think, a new age of medical care that is based on adult stem cell activity that's your own body using its intrinsic systems to help effectively change a pattern that is something that is genetically destined. So it's been very successful, and with over 5 years of data, we have really a tremendous pride in in the quality of the outcomes. So I think you could learn more about hair regeneration as an option for you. You can certainly, I think, safely stop the Rogaine. I don't know how you would continue if you were developing these side effects. It's kind of hard to justify doing that, and I don't think it's necessarily healthy for the scalp. So, and of course, meet with doctors who can offer you some guidance as to what your options are. So I hope that was helpful. I wish you the best of luck. Thank you for your question.